This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
Welcome to the human side of healthcare. We want to talk some more today about COVID-19. And once again, we're delighted to have Dr. Robert Haley, who's the chief of epidemiology. He's an internal medicine physician. He serves at UT Southwestern. Thank you for being with us, Dr. Haley.
Very happy to be here, Steve.
You know, Dr. Haley, looking at the numbers this week, COVID-19 census is creeping up in all the hospitals here in North Texas. Now, it's not as high as it was earlier this year, but it continues to creep up. Do you have any thoughts on that?
Yes, I and everybody that I know in the healthcare area are very, very concerned right now that we're about to see a third wave. You know, we had the first wave back in March where it came upon us really fast, and fortunately Dallas had been closed down just in time to keep it from going strongly. But then when they tried to open up the state in July, then it just really came up with a second wave, really big wave. It was like up to 1,600 cases a day in Dallas. But that was quickly, when the governor issued a statewide mask order, it just plummeted after that. And since then, since through August and September, it was at a fairly low ebb. And just in the last week and a half or so, we started seeing another movement. And it looks like we're about ready for a major third wave, because what we're seeing is people are getting tired of wearing masks. They're tired of being shut in, and we see a deterioration in our carefulness. And we expect that is about leading to another wave. And my colleagues in the intensive care units and the hospital wards are right now mobilizing and organizing to be ready for to be overrun again. So this doesn't look good, and we need to get back our discipline to keep this from overriding us again.
You know, you brought up an excellent point about the tools that we've got and some of the things we need to do to really tap this down. And one of those is wearing a mask. And I know many of our listeners may get tired of hearing that, but can you touch on the tool that we have, wearing a mask?
Yes, put that in context. There really are four tools we have: masking and distancing, and testing and tracing. Those are the public health mechanisms that can really tame this virus. We can put it at bay. You might have seen on the television about a week to 10 days ago, the CDC director, Robert Redfield, was in a congressional hearing, and he held up his mask and said, look, we don't know how good this vaccine is going to be, but this thing right here, this mask, can control the virus. We could stop it with this mask if everybody would wear one. The evidence for masking is just undeniable. There's a huge degree of evidence now that's very convincing. We now know that masking of the person who is infected is extremely effective in preventing them from infecting others. And for the people who are not infected, who don't want to be infected, wearing a mask is actually very helpful in preventing them from getting it. At first, we thought it was only to protect those around you, but it's also protective of the person who's not infected. And there's multiple strains of evidence that prove that now, and that's well accepted by all the authorities. So if everyone would wear a mask, this thing would go down to nothing, and we would be able to go about our business, open up our economy. Everybody could go back to work, and we could do everything just about except drink in bars and eat out in restaurants. Everything else we would be able to do. Our economy would come back. People would get jobs again. It's all due to masking. That is the common denominator. Also, if we can drive the rate of this infection down close to zero, then the testing and tracing setup can really do its thing and snuff the thing out. But if we go back into geometrically increasing numbers of cases, then that overwhelms the testing and tracing, and it can't do its job. So it all works together to keep us safe.
You know, you bring up such a good point about we need to be diligent in wearing the mask. One thing I have noticed, Dr. Haley, when I'm out, like if I'm in a grocery store, many people will wear a mask, but they don't fully cover their nose. They kind of have it below their nose, all droopy. I think it's important for people not only to wear a mask, but to wear it properly.
Yes, that's for sure. Now let me say the evidence on this is not quite as clear. You know, if you wear it over your mouth, I think you're protecting those around you, because speaking and yelling and singing are the things that spread it to others around you, and a mask would prevent that. And I'm not sure you need to cover your nose to prevent infecting those around you. But for protecting yourself, your nose is even more important than your mouth, because when you breathe in, you're breathing in through your nose, and that's where you're going to get the big dose that's going to put you in the intensive care unit. So if you wear it and don't cover your nose, you're protecting those around you, and that's good, but you're a sitting duck. So to me, when I see somebody wearing it and not putting on their nose, I say, hey, thank you for protecting me, but gosh, I'm so sorry you're going to leave yourself open to it and may take a trip into the ICU from which you may not come out.
You know, that's good advice. I'm going to ask you another question, and I've seen this and I've read this, but there's a lot of information out there, and some is more accurate than others. If you wear a mask and you do get exposed, does it decrease the viral load that you would have? And maybe even if you become infected, you wouldn't be as sick?
Oh, absolutely, that's true. And there's a classical experiment that was published just a couple of months ago where they took guinea pigs that are very susceptible to this disease. They took guinea pigs and did an experiment where they infected some of the guinea pigs, and then they put a shield over the well guinea pigs. They put like a mask with masking material, and they found that yes, they could become infected, but the infection took much longer to develop in them than in the ones who were not protected by a mask. And as a result, the immune system had time to kick in and make the infection so that it was only a minor, mild infection, whereas those that were not covered by the mask, protected by the mask, had a rip-roaring infection that began quickly and overwhelmed them and had severe lung pathology before they could respond, their immunologic system could respond. So yes, wearing a mask gives you a much lower dose, makes it where the infection doesn't come on as soon and you're not nearly as sick.
Dr. Robert Haley, epidemiologist and professor at University of Texas Southwestern Medical Center, and also spent time at the CDC. Thank you for that practical knowledge. We're going to hear more from him next week, including that full story on the guinea pigs. Now, when we come back, you know David Finfrock? Of course you do. The meteorologist at Channel 5 who has been there for over 40 years. Well, he got bit by a rattlesnake recently. We're going to talk about it next on the human side of healthcare.
This is the human side of healthcare on 1080 KRLD and the radio.com app, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
And welcome to the human side of healthcare. We're delighted that you're with us today. And today we're going to talk about a little unusual topic. You know, our hospitals talk about things they do for the community, and the good thing is our emergency rooms are open 24/7. And we have a guest today that really needs no introduction. I think most of the people in North Texas know David Finfrock. David, as you know, is with NBC5. He's the senior meteorologist, but something happened that really was not related per se to the weather that he's usually dealing with. He unfortunately encountered a rattlesnake. And so, David, can you explain to our listeners kind of what happened?
Well, I've been a long-time volunteer out at the Dogwood Canyon Audubon Center in Cedar Hill. Support them financially. I'm on the board there. And in the last, 3 weeks or so, I spent maybe 25 hours out there pulling up ragweed, which is obviously something that no one wants to see. It's the giant ragweed gets like 6 feet tall, and it chokes out the native plants in that area. So I've been working on clearing that out, and it made some real good headway. But Monday morning, it was nice and cool. I was out working, and after about 45 minutes, I was again making good headway, clearing it out. I stepped back, and all of a sudden, just felt this sharp jab above my ankle on my left leg. And I yelped and jumped off to the side, first thinking, it was a wasp or maybe a scorpion or something. I turned around, and there was this big old rattlesnake coiled up there. I don't know how I missed him. It was so big. But I didn't see it at all. Those mottled brown scales just faded into the grass, great camouflage. But it bit me, and I jumped away and was just really shocked.
So, David, let me ask you this. Rattlesnakes, and I've encountered them when I've been out before as well, but I usually can hear them, or as you say, see them. So you really had no indication whatsoever this rattler was around, did you?
No, I did not. And that was really strange to me because, out at our ranch, I've encountered maybe half a dozen rattlesnakes over the years, and they always rattle to let you know that they are there. They don't want to waste venom on us. They want to save that for hunting their prey. So they rattle so that you know they're there and you avoid them. But this one didn't rattle. Maybe it's because it was a cool morning. It was in the upper 50s that morning, and maybe it just hadn't really woken up yet until I stepped back within like a foot of where the snake was coiled up. I didn't know it was there, and then it zapped me good. But like I said, they can control their venom. The fang, it was only one that went through my jeans and my sock into my leg. So it hurt. It bled down my sock. And really, after that initial sharp pain, I was really surprised that, I'm not feeling worse than I am. This is a rattlesnake after all. And I was honestly toying with the idea of, just moving to a different area and continuing my work. And then I thought better of it, and I said, David, come on, use your brain. You've been bitten by a rattlesnake. You need medical attention. So I first went to a nearby urgent care clinic, and they said, no, you need to go to an ER. And so I drove myself there thinking, this really doesn't hurt that bad. Maybe he didn't put much venom in. And when I got to the ER, I walked in, and as soon as I said I'd been bitten by a rattlesnake, there was no, go back and wait in the waiting room. They took me right back into an ER room, put an IV in, examined the bite. Doctor came in, looked at it, but there was no redness, there was no swelling, and they drew some blood, tested that, and there was no sign of the snake venom proteins in my blood system, so evidently it was a completely dry bite. He stabbed me with the fang, but did not inject venom, and I am just extraordinarily fortunate that that was the case.
You're right. I lived in Georgia for a number of years, and they have timber rattlers, and they have, of course, copperheads like you have here. And I didn't realize until I was talking to an ER doctor one time that told me on some copperhead bites, about 20% of the time, they do not inject venom. So I'm assuming you didn't have to get any kind of anti-venom.
Right. That's why they did the blood work to confirm what we were seeing, that when I looked at my leg, there was no swelling, there was no real redness, just one small puncture wound that had bled. When you go in and they show you that chart on the wall, what is your pain level from 0 to 10? You got the little smiley faces fading into these really pain expressions when you get up towards 10. What's your pain level? I said, well, about a 1. I've had mesquite thorns that hurt worse than this.
I know what you mean. Those mesquite thorns can be pretty tough. So let me kind of pivot a little bit, David. And if you had one thing to tell our listeners that you've learned from this that maybe would help them, or a nugget of information, do you have anything you'd like to share with the listeners, especially about being out and about this time of the year?
Well, number one, when I'm down at my ranch, I have boots that I wear. I didn't have any in town. I'm going to go buy another pair of boots. So when I'm working in tall grasses like this, I am better protected. If I had had boots on, I don't think the thing would have affected me at all. And so that's the number one takeaway. Wear boots when you're doing this kind of thing. The second is just really be aware of your surroundings. I had gotten used to, after, like I said, 20, 25 hours volunteering out there, of stepping into all this tall grass and pulling up this ragweed and carting it off. And, it was like second nature. I wasn't really paying much attention. And that's a big mistake. You need to always watch where you step, be aware of your surroundings.
Well, I think that's great advice. And, as the weather is getting cooler, people do have to realize that snakes are going to act differently than maybe they do, say, even in the spring or summer. Thomas, I know that you're an outdoors person, and I know you hike quite a bit. So you may have some questions for David.
The one that strikes me as a little bit off, but I'm thinking so many people today who do anything outdoors always have earbuds in. Now, you didn't mention that, David, but I could only imagine that earbuds could block out an otherwise rattling rattlesnake.
I hadn't thought about that, but you're right. I generally have earbuds on, listening to music while I'm working just to pass the time, but my battery had run down and I hadn't gotten it recharged. So I did have my phone out there just sitting on the ground playing some music, but I didn't have earbuds in, and still I didn't hear anything at all from the snake.
Was the bush that you were working in one that should have been shaken? Was it something that you could have gone in there and disrupted it a little bit and then see if anything flushed out?
Well, the ragweed is 6 feet tall, a lot of it, and it's long stalks that stick up, and then there's lower grasses that kind of obscure what's happening at the ground. Perhaps if you go in with a rake, could check out an area first and make sure there's nothing hiding in those lower grasses. So that maybe that's something I'll consider next time I'm out there working, because I'm not about to give up. I'm going to get rid of this ragweed. I'm on a mission out there. That snake's not going to scare me away.
Good.
I'll just be more careful.
Good. Yeah, we've got the upper hand on the reptilian, don't we? The other thing that comes to mind, too, you mentioned the size of this snake. And older rattlers do have that ability to control their venom. So it sounds like this guy just said, hey, you're in my house, you're in my bush, it's a cool morning, I don't feel like moving around, get out.
Yeah, I think that's exactly what it was. It was what you would call a warning shot. This was a big snake. After this incident, I watched it. It did wriggle away into the woods, and it looked to be about 4 to 5 feet long. I talked to the director of the Audubon Center out there, and she told me that they had spotted one that was about 5 feet long just 2 or 3 weeks earlier, and so we think it's probably the same snake. She's talking about maybe getting somebody out there to try to hunt it down and relocate it to another location, because snakes are good. They control the rodent population, which causes a lot of disease. So snakes have their place in the environment. I just don't want them right around me.
A true Texas legend, David Finfrock, in our living rooms for the last 4 decades, telling us the weather here in North Texas. Thank you for being vulnerable and telling us your story, and also for the very clear reality that you, my friend, have something looking over your shoulder. All right, when we come back, we're going to take up the medical side of this and go visit with Dr. Erik Ledig. He's the Emergency Department Director at Texas Health Willow Park, and he has treated some snake bites in his career. He's going to tell us all about it, and all of this is on our podcast as well, The Human Side of Healthcare. It's on all the major podcast players. We'll be back after this quick break. Stay with us.
The DFW Hospital Council, along with our over 90 member hospitals in North Texas, are proud to bring you the human side of healthcare with Council President and CEO Stephen Love and co-host Thomas Miller.
Welcome to the human side of healthcare. We're delighted you're with us today, and we're going to continue our discussion related to snake bites. You know, we talked in a previous segment with David Finfrock about he got bit by a rattlesnake. Well, we thought it was important, especially as the weather's turning cooler and things are changing, that we talk to an emergency room physician. And we're delighted that we've got Dr. Erik Ledig, who is an emergency department director at Texas Health Willow Park with us. Thank you so much and welcome to the show.
Thank you for having me.
You know, I think a lot of people don't realize we have quite a few venomous snakes in the state of Texas. Copperheads, water moccasins, obviously rattlesnakes. So let's get right to it. If Thomas or I were out hiking and we were a mile or 2 or 3 miles away from where we parked our car and we got bit by a snake that we knew was venomous, what should we do?
Well, that's a good question. First, I would get to a safe place and then call 911. This does two things. One, it alerts the system to know where you're at to get to it. It also notes the time of the bite. That way you don't have to recall that time. You can just look at your phone. Second thing I do is stay calm. Oftentimes we get heightened and our heart rate speeds up, and that can lead to more circulation of that venom. So staying calm and limit movement is going to be important. Allow the bite to bleed initially, and then you can cover it with a dry, clean dressing. If you have access to something to clean it with, you can clean it with it, like water irrigation, dab it dry, and then put a clean dressing over it. You want to remove any restrictive clothing or jewelry as soon as you can. Sometimes these bites can start to swell up rapidly. Sometimes it takes time to do that. But you want to remove those things so they're not constricting. Then I would recommend transport by vehicle. If you're a mile out, if you can get the vehicle closer, if you do have to walk steadily. I wouldn't do any running or any increased exertion. If you're by yourself, I would definitely get 911 to come and drive you to a location. Otherwise, I'd have a friend or somebody else that's with you do the driving to get you there. I would not kill or handle the snake. I wouldn't try to trap or kill the snake. But if you have an opportunity, you can take a picture to help identification process later. But don't waste time trying to do that. If you can recall what it looks like, that is helpful in trying to identify it later. There are a couple of don'ts that I would say not to do. That would be don't apply a tourniquet, don't try to cut the bite, don't use cold compresses, keep the area below the level of your heart if able, don't raise it, don't suck on it, don't use a suction device, and I wouldn't eat, take any medications, or drink alcohol if you know you've been bit. Any of those things can worsen any reaction that the snake bite could do. So I wouldn't eat, take any medications, or drink alcohol.
In your experience in an emergency department, when a snake that's venomous does bite an individual, is there a chance they inject very little or no venom sometimes?
Yes, definitely. The majority of bites that we see are what's considered dry bites or minimal reaction, and those don't require the treatment, which is going to be antivenom. In my research, I found that about 45 to 50,000 cases of snake bites are reported each year in the United States. 7,000 to 8,000 of those are going to be from a venomous snake, and then that leads to 5 to 6 deaths a year. So the majority of the time that we do see bites in the emergency room, there are going to be dry bites or minimal venomous reaction, not requiring antivenom. But these snake bites still need to be monitored, watched, and evaluated. And usually the time it takes is around 6 hours of monitoring to ensure that it's not going to lead to a venomous bite. And I would treat all bites initially as a venomous bite and get to a hospital system. My recommendation is to go directly to an emergency room. Not all facilities are going to have access to antivenom, which is going to be the treatment in venomous snake bites. If the emergency department doesn't have, or the urgent care doesn't have that access to antivenom, you're going to delay the treatment. Most emergency rooms, and the ones that I work at particularly, do have the access to that antivenom and can get treatment done in a really quick time.
Let's assume that you get bit by a snake, you get a good look at it, and let's assume you're someone that's fairly familiar with snakes, and you're pretty sure that this is not a venomous snake. But to follow your advice, let's still treat it as though it was. You still should come in and have it cleaned and maybe get a tetanus shot, shouldn't you? Because you don't want to get an infection.
Yes, I agree with that. If the tetanus is greater than 5 years, we'll update the tetanus shot. We'll evaluate the wound to prevent any secondary infection. And then there are other things besides the venom that can cause reactions in the body. You can have allergic reactions that may need to be treated as well.
So Thomas and I were talking about this before we interviewed you, and he is an avid hiker. Suppose he's in an area where he's out of cell range, his cell phone wouldn't work, and you get bitten by a snake. Is there anything else you would advise when you know there's a longer period of time before he's going to get in a cell phone range?
So prevention is everything. As we find in medicine, prevention is 70% of everything we do. So going out into an area out of cell phone range, I would always bring somebody else. If you're injured or anything else happens, you have somebody that can either get you to safety or get help to you. So I would recommend not going alone when able. The other things I would recommend is if you're in a brushy area, you can't see wear high boots, wear long pants and sleeves. We know that the depth of a bite is really important to how much venom a snake can excrete. So the less depth, the better you do. The more depth, the worse you do. So while wearing long pants, long sleeves, and high boots is going to prevent a lot of that venom. Secondly, don't reach into areas you can't see very well, as you can get bit and put yourself in harm's way. Lastly, on trails, snakes are going to avoid confrontation, so making noise and paying attention to surroundings can also be very helpful.
For our listeners out there who aren't familiar with antivenom, if you were bitten by, say, a copperhead or a rattlesnake or a cottonmouth here in the state of Texas and went to the emergency room and you determined you needed to administer antivenom, is it different for each snake, or is there kind of a universal antivenom?
So we have two types of antivenom. We have the crofab, and then we have a horse serum antivenom that is used for rattlesnakes now. Of those snakes, the rattlesnakes are the ones that benefit the most from getting that antivenom. I have given it to a copperhead or two, but most copperheads are not going to require antivenom. However, they still need to be monitored and watched, as some of them may indeed need it. So of those families of snakes, the rattlesnakes are the most likely to get the antivenom.
How is the antivenom administered?
So the antivenom takes a little bit of time to get ready to give it, and it's administered by IV. We monitor it because there are some side effects that you can get from the antivenom, such as a hypersensitivity reaction, an allergic reaction. There's also a late reaction, a serum sickness that you can get, but all those things are monitored and can be treated once those signs show up.
What is going on inside the body and around the snake bite itself after you did take a venomous hit?
That's also a very good question. It depends on what type of snake we're dealing with. In the States, we don't see the elapid family of snakes, the cobras and the coral snakes. We do have some coral snakes in the States, but the bites are very rare. These are the snakes that do the neurotoxin. So we don't see the paralysis and the neurosystem things that can be seen in other places in the world. What we see mainly are the viper family, as alluded to earlier, the rattlesnakes, cottonmouths, and copperheads. And so the symptoms we see mainly are swelling and tissue destruction, blood clotting problems, injury to muscle. We can see shock-like states with low blood pressure, resulting to kidney damage. And so those are the things that we monitor and we watch. In the ER, initially, what we'll do is we'll start monitoring the wound for swelling and for pain. And we will also get labs to evaluate to see if there's any reaction going on in the bloodstream, namely coagulopathies. That's why the monitoring process may take 6 to 8 hours before we can clear someone or before we determine whether the patient will be admitted or sent home.
If you have a relatively young snake versus an older snake, and you can define that any way you want, is there any relationship between the age of the snake and the amount of venom they put in the body?
That's a really interesting question, as I used to believe that baby snakes didn't have the ability to regulate how much venom that they were giving. And the adult snake did, and thus the adult snake could give lower amounts and the baby snake would get everything it had. When I did research on this, I found that that's not quite true. The adult snake, depending on the size of the snake, is going to have more venom and thus be deadlier than the baby snake. So the size of the snake and the adult snake, I would say, would be more deadlier than a baby snake, just based on the amount of venom it can carry. Now, a dead snake is something not to be trivial with, because it can still bite and it can release lots of venom. So playing around with dead snakes can be very deadly for limb loss or health. But I think that's a great question, yes.
Dr. Erik Ledig from the Texas Health Willow Park Emergency Department with some great advice for any of us who like to be outdoors in North Texas. We're going to be talking to Scottish Rite for Children next on the Human Side of Healthcare.
We're continuing our conversation on how you can empower yourself to have the best health possible in today's ever-changing healthcare environment. This is the Human Side of Healthcare with DFW Hospital Council President and CEO Stephen Love and co-host Thomas Miller.
Welcome back to the Human Side of Healthcare. We're checking in with legends in North Texas in this show. Earlier, we talked to David Finfrock, a stranger to almost no one. And now we're going to move over to Texas Scottish Rite, an institution in the Dallas-Fort Worth area that has touched so many lives here and around the world. Since COVID-19, they've been involved in some significant research studies that we want you to hear about.
We've got Dr. Kirsten Tulchin-Francis. She's a Division Director, Movement Science Laboratory at Texas Scottish Rite Hospital. And we have Dr. Whitney Herge, who's a pediatric psychologist at Texas Scottish Rite Hospital. So I'm going to jump right into it. Dr. Francis, your study looked at activity levels. Can you explain?
Sure, thanks. Originally, our study really stemmed from a different project. We were really interested in understanding how children play on the playground, actually. What level of intensity do they get up to when they're playing on a playground? How does that contribute to the recommended 60 minutes of moderate to vigorous activity that children and adolescents need every day? And when COVID pandemic started and playgrounds got canceled, recess got canceled at school because the kids were no longer in school, our study team actually completely shifted focus and decided that we wanted to understand the impact that the pandemic and specifically social distancing and shelter-in-place orders where we had to, quarantine at home, how that impacted the physical activity and the play behavior of children. So we did that through a web-based survey of parents, and our kind of target audience were parents with children between the ages of 3 to 18 years that lived in their home. And we were really asking, how much do your kids play now, and how much did they play before, and what kind of play did they do in the yard, in the community? What resources did you have access to? So it's a really great study to understand the impact that the pandemic has had on the level of activity that kids are getting.
That's amazing data. And I guess a question that our listeners would love to know is, as you complete these studies, what is your timeline, and then how are they going to actually be shared with the public? or what are your overall plans with disseminating the findings?
That's a great question. So our first step, obviously, is we are submitting our manuscript to some scientific journals. Those are actually under review right now. The second part is we did do a joint presentation with Dr. Herge and also Dr. Henry Ellis, who's one of our sports medicine physicians. He had a third survey, actually at Scottish Rite, in the same time period that looked specifically at youth athletes and what impact the pandemic had on their activity levels. And we did a joint presentation about a month ago, which I believe you can find on our Scottish Rite website, where we each described kind of what our study was and what our preliminary findings was.
When you look at your study, an 18-year-old's activity is probably much different than an 8-year-old. Do you look at the age in any way when you're analyzing the data?
Absolutely, and we did find significant differences based on age. So one of the things that we looked at was not only how often the parents reported their children got moderate, vigorous, or light activity, but also the type of activity they did and who they did it with. So for example, did you do outdoor activity in your yard or in your neighborhood? Did you do outdoor activity in your community? Did you do outdoor activity alone in the yard, or did you do it with a sibling or a friend? Now, obviously, during social distancing, peer play across the board, all ages, all types of play decreased. That's a good thing. That means that our survey respondents were adhering to our social distancing and shelter-in-place mandates. However, we did see drastic differences in the amount of physical activity decreases in the older kids. So I think that kind of makes sense. You're less likely to see, a 17 or 18-year-old go out and play in the backyard as you would, say, maybe a 6 or 7-year-old. So we did show that the decreases in activity level were much greater in the older children than in the younger children. In fact, the impact of the pandemic on physical activity in, say, preschoolers was actually the least, and the impact on physical activity was greatest in the high schooler age group.
Dr. Herge, you were involved in a survey that looked into responses to stress that was brought on by COVID-19, and you looked at how it impacted the entire family, not just the kids. What was the nature of that study?
Well, first of all, thank you so much for having us. It's an absolute pleasure to be able to speak with you. The purpose of our study is to evaluate the stress and coping responses of individuals in response to this completely novel stressor, the COVID-19 pandemic. And our aim is to try to evaluate a variety of different participant groups, including hospital patients of Scottish Rite for children if they're 18 years or older, as well as their family members, our hospital staff, and community members at large to try to assess their psychological responses to this now ongoing stressor.
The stress and the response, as you mentioned, is so important. Do you have any preliminary results yet?
Well, we're still at the very beginning stages of our data analysis, but unsurprisingly, a high percentage of our sample has been endorsing stress in a variety of different domains. So a large percentage of our population, unsurprisingly, reported concern regarding loss of employment, concern about contracting COVID and getting sick. Interestingly, people do seem to be more concerned about at-risk loved ones getting sick rather than themselves getting sick. And similarly, participants do appear concerned about becoming socially isolated, but they're actually even more concerned, it appears, that about family members becoming isolated. And participants have also endorsed worry about not being able to access their health care, not being able to work or pay their bills. Despite these stressors, however, participants' reports of post-traumatic stress appear generally low at this point in time. We are going to be reassessing our participants. We're getting ready to reassess them for a wave 2 of data collection, and we'll also be doing a follow-up at wave 3. So it will be important for us to try to evaluate this data further to determine what percentage of participants may actually meet criteria for something like PTSD, and to continue to track this over time. Additionally, our early results are suggesting that participants do tend to use certain coping skills more frequently, such as active coping, distraction, positive reframing, planning, acceptance, and religion.
Those are some interesting preliminary findings. And if If I could expand on a couple of these, I know you're conducting the study, so you're gathering data. Do you, during the study, help people learn some good coping techniques, or do you make suggestions to them on how to handle their stress, especially the isolation you mentioned?
Well, at the close of our study, once participants have completed all of the questionnaires, we do have links to resources that already exist for both children and adults, available in both English and Spanish, to try to help provide some of that education and some of that support right now.
Well, that's good, and it's good to have those resources to help the people. As you look at the data, how do you hope to apply it, say, to the real world and how we can use it?
I think that's a great question. Our hope is that community stakeholders, so really our hospitals in the DFW area, will be able to use the information that comes from our research study to provide education to the community. I think that it will be beneficial for community members to be aware of common stress responses, such that they can identify when either themselves or family members are struggling, and especially when it may be important to seek professional support. This study may also be helpful in providing education, exactly as you were just mentioning, on which coping responses appear perhaps most beneficial or perhaps even protective to individuals in response to the COVID-19 stressor. And stakeholders can then educate the community on these useful coping tools.
Very special thanks to Dr. Whitney Herge and Dr. Kirsten Francis for joining us to talk about these very important studies over at Scottish Rite for Children. Dr. Haley's going to be back next week for an in-depth class on masks here on the Human Side of Healthcare. We'll see you then. Stay safe.